a non-healing corneal ulcer, because even as general ophthalmologists, we deal with such patients who, they when they are not responding to treatment, they become impatient. So how do you deal with them? Of course, you send their cultures, you show them that this is what you have, but still they always come up and say all your medicines are not working. So how do you deal with that sort of a situation?
So a good slit lamp photography showing serial visits as to whether it is responding or not, and good documentation of every subtle sign as well regarding the same. Second point being culture and sensitivity plays a really important role, and this really does help. If sometimes it's a non-healing ulcer and you've tried everything in this, it's nothing is working, then you might have to do a therapeutic PK. So then you have to again explain the same thing that Samar sir has said, that we are trying to remove the infection. This is not for vision purposes, and this is an attempt to get the infection out. And once we get that out, once we take out the tissue, then it will give a better culture report, and then we can treat it on a as a point-to-point basis, a direct therapy to the thing, because you will know what organism and what drug will work. At the same time, it is extremely important to be honest with the patient. And second of all, whenever if you are in doubt, bus you can't do anything more. It's a good idea, at the same time, there are so many groups on WhatsApp, so you can put those pictures up, on different groups, and there is somebody senior, there will be somebody in India, who, or internationally, who will help you out. No, this is going to work, this is going to respond in such a way. And the other option, you can call up your seniors as well. So I had one similar case of a bilateral pythium keratitis in a child. I have to publish it. I've written it, but for the last 6-7 months, it's like that. And it took me about a month's time, and the child became okay. But the reason that child had confidence in me, two things that person saw, the father saw. First of all, I was very transparent with all serial photographs that this is happening. Second of all, when I also was confused, he saw that let me discuss with my gurus and then get back to you. At the same time, I trained the treatment, and eventually the patient did well.
For any corneal ulcer, the rule of thumb for anybody, even today, what we say that whatever available medical treatment only works 65% of the cases. Rest 35%, it will be some kind of non-healing ulcer. So in those 35% cases, we take the call for either therapeutic PK if the tissue is available, or you may need to do tarsotherapy, or you go to wards. So first, when we see the report after doing KOH and gram mounting, we get preliminary report. We say that you have a fungal ulcer. We are giving there is no medicine available. Only one medicine is available currently in the market, that is natamycin. Other medicines we are making it. So the probability of this ulcer will heal is 65. Out of 10 ulcers, only 7 cases heals. But rest 3 cases, it doesn't heal. Then we have to take surgical steps. So first day I tell the patient, we all tell the same story, that 65%, even though your reports are there, that is resistance to organs. So you do not have all the bacterials, we know so many resistance. So we do not talk about the resistance, but if you said in honestly and serial photograph what Coron says, if it is going good, you can show. Again, in worst scenario, you saw that no, we have tried, you see the report, this is the culture report, we have given the best possible report, treatment, but still not responding. So it takes other help like surgical help.
Right, sir. So one thing that we do in our practice is that we have a stamp. Any corneal ulcer patient who comes, we stamp their prescription, and in that it is written that dhundla dikhega, pura ratan saaf nahi hoga. First visit, whether we know it's going to heal or it's not going to heal. So, the expectation on day one only, comes down.
Yes.
I was following the same also, Rohan. A stamp is made specifically for PK cases and separately for infections, all types of ulcers. That it's this big stamp that says all of those prognosis explained. It's a good idea.